This used to be me. Hi, my name's Rob. So I was working in a manufacturing facility and I was standing 10, 12 hours a day, 6 days a week basically. I had gained so much weight that even I have a big truck and I was having trouble even fitting in there anymore. You know, I didn't want to go anywhere, I didn't really want to do anything. My legs were so swollen that my pant legs didn't fit properly, and my shoes over the course of the day would basically be so tight that it was hard to walk, hard to stand. So in 2018, I went to see Dr. Ahsan, and I stepped on the scale and it didn't read correctly. So I told them I was 480, but I was actually probably over 500.
Rob's presentation was complex. A lot of times when people present in the clinic with leg swelling, most people try to compartmentalize this whole process either as a vein-associated swelling or lymphatic-associated swelling or obesity-related swelling. And to be honest, most swelling is not either or, but it is a complex presentation of all those things coming together to play a role. The ankle swelling is probably from the veins. The foot swelling, the toe swelling is from the lymphatics, and the overall fluid overload is from obesity or a weight gain. So when I saw him, I put him down as a multi-complex process causing swelling with acquired lymphedema, venous insufficiency, and of course morbid obesity. And usually when you do that, then you can really start working on all those aspects at the same time. So a comprehensive diagnosis was made at the time of the first meeting, and a comprehensive plan was instituted at the same time.
And we actually found out I had a few other issues. Extreme fatigue was the biggest one, and then so they sent me for sleep apnea, and then they also realized I had low potassium and high blood pressure. So I was on a bunch of pills at the time as well. He told me I needed to lose some weight, so that he put me on what his nurses call his crazy diet, where you basically cannot eat anything.
The reality of this is that the patients already know they have a weight issue even before they walk into your clinic. And if I ask them to lose weight, have I really helped them? Have I really given them the direction they need? I tell them to eat right and be right. I give them a specific plan of lifestyle changes, which is heavily diet related, but also not completely. It's usually a 6-point plan. 3 of them are dietary instructions, 3 of them are lifestyle instructions. I ask my patients to stop intake of all processed food and all processed drinks. So I target salt, sugar, and preservatives rather than just targeting salt, which is mainstay when it comes to swelling. We try to reduce salt, but somehow we tend to forget about the carbs, we tend to forget about the preservatives. So the first 3 instructions is exactly that. Stop eating or drinking anything that is processed.
Almost every food you buy has a lot of salt in it. It's very difficult to find stuff that you can buy at the store that would help me. So I started making my own food essentially.
The remaining 3 down below that point are lifestyle. Remember I said it was a complex presentation. A lot of my patients who are suffering from similar ailments, they're sleeping in a chair because in bed they're very uncomfortable. And sleeping in a chair makes the leg swelling 10 times worse because people don't realize the heart really doesn't pump things back up. It just pumps things down. And the body in itself has to zero in on the fluid returning back to the heart when they're lying down. But if you're in a chair or a recliner, it really never happens. Just putting your feet up doesn't cut it. You have to be in a bed. So that is the instruction number 4, that spend time, at least 6 to 8 hours in bed. Instruction number 5, take good care of the skin. Skin is your foremost compression sock that you have naturally. It's your first defense against swelling. So if you are able to take care of that, then hopefully it'll help decrease the swelling. So I tell them to take good skincare. People use moisturizing agents and all sorts of things. I recommend using grapeseed oil. It has a little bit of anti-inflammatory property to it, which does the magic for a lot of my patients. And the last one is, of course, exercise. Now, I'm not talking about joining a gym. This is your calf foot exercise where you kind of use the pedaling of the foot and the calves and trying to exhaust your muscles as we do so. And this helps improve our peripheral heart, the heart that lies in the legs and pumps the fluid back up.
When I moved in this house, I got a German Shepherd, and my plan was, well, she's an active dog, so I'll have to walk her every day, and that's how losing weight really began. I started only walking about halfway down the street, and then as time went by, I'd walk all the way down the street, increasing my time walking to around 2 miles a day. My goal is to get to 220. I'm at 300 right now. Dr. Ahsan says I probably have 20 to 30 pounds of excess skin still right now, which he has a plan to have that get removed once I get farther along.
He is definitely a success story, but a story that's not ended as yet. We are still in the process of evolution. I define success as if a patient is able to turn around and say, I am doing better than my last clinic visit. That's success. Doesn't always mean it's a culmination of the process. Maybe it's a process still in evolution, but it is a success nonetheless. I am hoping that we will go from strength to strength and success to success and never look back at the old Rob. But I think we have to remember that every present has a history, and the history many times defines our present and the future. And we have to keep in mind that we don't want to go back. We always want to move forward. So is he a success in my mind? Absolutely.
It's not over, and it'll never be over. It's going to be a lifelong thing. You know, you can't just, you lose all the weight and then start going back to what you were doing before. It's a whole change in your life. If it wasn't for Dr. Ahsan, I'm not sure if I would even be here today. And losing all the weight really helped me. You know, I'm way more active than I used to be, and I feel better and sleep easier. Everything is better.